Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us today. We're excited to be with you. We're going to discuss celiac disease, and a lot of people have it. Some people are aware they've had a diagnosis that they have it, and many others have celiac disease, but it's never been diagnosed. Also, there are many people who have been diagnosed with celiac disease, but in part, they've been partially diagnosed. In other words, they have the correct diagnosis, but the doctors involved in the diagnosis, and the parents usually, or the adults if they're diagnosing it themselves, have not done adequate comprehensive diagnostic testing to see why they have this celiac disease. So there are some limited areas out there, and as doctors of chiropractic who practice orthomolecular medicine, meaning, yes, we're licensed as chiropractors to take care of the spine and nervous system just like all chiropractors are, but we have a very special interest in metabolic issues, as some chiropractors do, but our issue comes from a science-based background rather than some voodoo nutrition background, as some people are involved with. So what we're going to do today is Dr. Jensen is going to begin our discussion of celiac disease.
Thank you, Dr. Lala. Well, celiac disease affects many people throughout the United States and the world, really. It's widely thought to be a gastrointestinal disorder, and if missed, is thought to affect 1% of the population, which can be quite a few. It's an emerging disease, again, thought to affect only about 1% of the population, but in reality affects much larger percentages just due to people not being checked, and what they find is, such as like in the thyroid problems, once they started to do screening tests on these, the evidence of this disease went up from just a few percent up to 10% of the entire population, just because more people were being checked for it. So here's something to look at with this emerging disease profile of celiac disease. Many times it's also misdiagnosed. Many people are not correctly diagnosed with celiac disease, and many are not widely or wholly diagnosed, therefore are incorrectly or partially treated. Knowing what you're treating is half the battle. You know, it's being able to get you the correct treatment for it, and that's the problem. So, Dr. Lala, what are some of the symptoms that we might find for a diagnosis of this?
Some of the symptoms, very common, of celiac disease are diarrhea, abdominal pain, anorexia, constipation, dermatitis, we would refer to that often as herpes, systemic herpes, short stature or systemic disease. Many of these manifestations of gluten hypersensitivity are systemic, meaning that they spread throughout the body, in that if those antigens, those are proteins, the gluten proteins, pass from the intestines into the person's blood, the blood carries them to other areas of the body, and we have then what's called a systemic disease. Some of the other symptoms related to celiac disease are depression, anxiety, migraine headaches, infertility, headaches, and osteoporosis. Some of the other symptoms related to celiac disease are ADH. That's really interesting. You'd be surprised the number of ADH new patients that are brought to our clinic who they have never done a food allergy test on them. Now, a very small percentage of them have been to endocrinologists who have done scratch tests on them, but almost never have they done what is called a food sensitivity test, where they're doing IG tests. So, symptoms again, ADH, learning disabilities, of course it's always related to ADHD, developmental delay in these children, cerebellar ataxia, meaning that their gait is not normal, epileptic seizures, and hypertonia. Now, Dr. Jensen and I aren't taking this out of some chiropractic literature, but we're taking it out of clinical chemistry, issued in 1994, some years ago. That's how far along ago they knew these things, and it was published in Clinical Pediatrics back then. Now, what is celiac disease caused by, Dr. Jensen?
Celiac disease is caused by an immune-mediated response to gluten proteins. And really, when you're looking at the proteins within a lot of grains, It's not, it's, many people pick on wheat, but it's not just wheat. There's all these different grains that contain gluten. And if you look at it, gluten has a subsection to it that's called gliadin, and within that there's a subsection about the first 12% of the gliadin string of amino acids that create this protein of gliadin has a lot of sulfur-containing amino acids. And what happens is these particular people have trouble digesting sulfur amino acids, and therefore not being able to break the bonds in that, or not able to break down the chain to its constitutional amino acids. And whenever you have that, if it gets into the bloodstream, then you start to have an immune reaction to it.
And the most common sources of sulfur would be legumes, right?
Legumes would have that, yes. You're looking at cysteine as the amino acid. So anything that's high in that particular amino acid. And one of the things that we find, that's found throughout the body. We find it a lot in our nails and our hair, particularly if you've ever smelled burnt hair. That smell comes from the sulfur content within the hair. But also you find those people who have curly hair have much more sulfur in their hair than people who have straight hair. And so it's.
How about people who have little hair?
Little hair?
Not as much sulfur, huh?
Not as much sulfur here. That's one of the big things with celiac disease. And with them, they could have a lot of problems, because a lot of the sulfur-containing amino acids help them in building the products that they need to help detoxify their body also. So it goes far beyond just this one hyperimmunity to this thing. So it can cause intestinal problems. People are disposed to those intestinal problems, but also because it's an immune reaction, the immune reaction doesn't just happen at that one spot, happen just along the intestinal tract. A lot of times it happens what we call systemically, or throughout the body. So therefore, if you have swelling along the intestinal tract, you're also having swelling within the joints, and so they almost feel a bit arthritic and more predisposed towards aches and pains in that way. They feel older beyond their years.
So basically, if they have a gluten allergy, diagnosed or undiagnosed,
right,
that therefore would predispose them to other immune-mediated responses, then other weaknesses, other health problems.
Absolutely. When you have we've shown that not only does it make you feel arthritic, but inflammation tends to make the white blood cells a little bit sticky and hold them into the joints. And white blood cells affecting the joints tend to lead us towards not atherosclerosis, but towards rheumatoid arthritis, and osteoarthritis is inflammation mediated also.
So one of the easiest ways to determine that, if they have some form of arthritis, is to go off of gluten-containing foods.
Right.
Or either nightshades.
I can tell you from personal experience that if I get off of those foods that I have adverse reactions to, if I'm off of them for 2 weeks, when I get up in the morning, I feel 20 years younger. When I'm eating them, I feel 20 years older when I get up in the morning, just because of that swelling that occurs within the joints.
So we're talking then something about how the body reacts then now?
Sure. When the body reacts to these allergies, they'll start to swell up in the intestinal tract, let's say. In the intestinal tract, there's certain stop gaps here between cells that stop this stuff from going in to the body and being introduced into the bloodstream, where the immune reaction takes place. But when we have this irritation that takes place in the gastrointestinal tract, the swelling actually parts these cells, and sometimes undigested food elements get in between there. And when that happens, we form an allergy to it. Now, that's not just the stuff that we have an allergy to. It's anything that goes in there. So one food sensitivity can beget a number of food sensitivities. It's just that one started the whole process. And so then we end up with irritable bowel syndrome, or what they call leaky gut syndrome. in which introduces things such as toxins and antigens and bacteria and viruses and other types of parasites, protozoa can get in there and gain entrance into the bloodstream, predisposing these people to systemic diseases as well, or diseases that affect the body as a whole.
So again, what we found in our orthomolecular approach to practice is that many of the symptoms that people come in with, that they've been given a diagnosis for, the diagnosis has been correct, but not the cause determined.
Right.
Or a false cause determined.
Or a false cause determined to it.
Therefore, malpractice occurs.
Yes.
Not that the doctor necessarily did something wrong as a malpractice issue, but the doctor failed to adequately diagnose, which we call lack of due diligence.
And then the treatment did not fit the disease.
Right? So the patient ends up malpracticing themselves.
Right.
Because they try this or try that.
Right, and try the shotgun effect, or a lot of times if they're using a rifle saying it's this and that's not the cause, and so they continue to have the problems. Sometimes they'll do that and they won't do it to the complete extent that they need to. And so if they're only using part of the solution, sometimes they get better results for about 2 weeks, and then next thing you know, they're getting results that are getting less and less and less. And therefore, they say, next time when it comes out that it's actually part of the real solution, oh no, I tried that, it doesn't work. And it's just because they didn't do it to the full extent of what needed to be done. And it's usually they'll be doing part A, but part B and C were never addressed.
And it's usually not the patient's fault. It's that they ended up in a medical doctor, chiropractor's office, nutrition office, who had a tunnel vision, was short-sighted rather than comprehensive and thorough.
Or sometimes they've read a book and they don't have any of the tests to show them that it was something different.
Right.
So they've just decided to treat themselves from a book and have found, which has deleterious effects there too, because they'll self-prescribe things and we find out they're taking 10 times the amount they need to of the one thing. Because a little bit is good, but a lot is great, right? Not necessarily so. So when we're looking at toxins, as we bring up this slide that we have here, it's showing toxins and the toxic effect that it has in the body, in that where we start out with what we eat, here we go, we have a number of different things like what's going into the ground, which makes into the foods, what kind of foods we're eating. Are we eating all these fast foods and things that are not necessarily healthy? And some of these restaurants are trying to do their best to change their diet, but it's what the people demand is what meets the bottom line too. So it's what we place in our body. Also, we have a lot of industrial toxic waste that make it into our body. You have to understand that every year we have something like 80,000 new chemicals that make it into our environment, things that our body was just not used to, and now it has to deal with, and sometimes don't even have a means of dealing with it. So then, therefore, that makes it into the body, goes through the gastrointestinal tract, which is then repackaged in the liver to try to get rid of it. And if it can't do that, it stores it within tissues of like the brain and the bone and fatty tissues to try to get it so it's not metabolically active while it affects us as it will. And those people who are trying to lose weight, all of a sudden they're releasing all this fat. Well, they're releasing all the toxins in the fat too. So losing weight too fast can be deleterious to your health, make you feel really ill, unless you do it at a nice slow pace that allows that slow detoxification. If you have a healthy liver and it deals with this, what it does is it changes all these things into a water-soluble solution, okay? And being water-soluble, it can go through the kidneys and then be excreted. And that's primarily what we want our body to do. However, remember I talked about when you can't digest the sulfur-containing elements, that sulfur-containing element to a high degree is what helps this detoxification. Go from phase 1 detoxification to phase 2. And phase 1 actually makes you more toxic, and then we break down in phase 2 and we're more toxic than we were, but it has to make it through both of them to be excreted.
Well, that leads us then to a little bit more of a discussion of the gastrointestinal system, huh?
Right. In the gastrointestinal system here, we're starting out with the mouth, which is the beginning of this tube that allows us to take stuff in and through the body. It's really, the gastrointestinal tract is what introduces the outside world to the inside world. And we try to do it as safely as we can. And part of that starts with the mouth having a pH range of 6.0 to 7. 7 is neutral, so it's very slightly acidic, okay? And really, in our saliva, we have salivary amylose, and amylose is the enzyme that helps break down sugars. And so we start digestion within our mouth. And by not chewing your food enough, it's very deleterious to your health also. Then it travels down the esophagus, which is, as we can see in the picture here, that's the tube that goes from the mouth down to the stomach. Okay? And once we reach the stomach, it has a pH of an acid pH of 1.0 to 3.5. It depends on what the contents of the stomach are. You know, the food actually changes the pH a little bit, though the hydrochloric acid tries to keep it down there. It's usually about 2. And it's very important. That's one of our first immune system defenses, is in there for the acidity can kill any of these bacteria and things like that. And many times what happens is when we have full sinuses, we have cilia in our nose that drives the mucus down our throat into the stomach to be dealt with the acid. And when that cilia isn't working, such as when we're out in the cold and it freezes them so they're not moving, we get a stuffy nose, the sinuses gets congested because it's not moving it there. It's not that you're manufacturing more mucus, it's that it's just not being moved where we thought it was. Okay? Then we go into the small intestine, where the pH range in the small intestine, we started out from the contents of the stomach at about a pH of 2, moves up to a 3.5 to a 7, and we're dumping stuff in there. Our body is dumping stuff in there to change that pH, because there's certain enzymes that work in an acid environment and certain enzymes that work in a alkaline environment. And so by the time we reach the distal part of the intestine, now we're working into the alkaline ranges to break apart more of these carbohydrates, where you use acid to break apart the fats and proteins. As we go on, the large intestine, which starts with a valve at the beginning of the large intestine, which is down here, the cecum or the ileocecal valve. It also has the appendix. By the way, they're finding that the appendix does have a function in that it incubates some of the good bacteria for us. And so that's what we're looking at, is sometimes we should have kept that to help incubate that, and therefore create eubiosis within the gastrointestinal tract.
Okay.
There's the ascending colon, the transverse colon, the descending colon, and the sigmoid colon ending up in the rectum to complete the gastrointestinal tube.
So what we've really been talking here about is irritable bowel syndrome. Involves imbalances within the acid-alkaline pH of the stomach and small intestines. Now let's talk about acid-alkaline pH in the mouth. The pH is typically 6 to 7, stomach 1.3 to 3.5. Small intestine, the proximal end, the front end of it, is 3.5 to 7.0, and then the distal, the far end of the small intestine, should range between 7.5 and 8.0. Now, harmful uses of diets and nutraceuticals. The pH of the diet and or the nutraceuticals, that's vitamins, minerals, or herbs, or homeopathic remedies, dramatically affects this pH, this biochemical status, the acid-alkaline status of the gastrointestinal tract, as well as the entire body. Now, all nutraceuticals, vitamins, contain what we call binders or extenders. They usually are should be non-vegetable excipients. They often have artificial fillers, artificial sweeteners, mineral salts, and sulfates, and carbonates, and artificial colorings. Now, we can also, many of them contain yeast, soy, egg, or wheat glutens. If it doesn't say yeast-free, if it doesn't say soy-free, if it doesn't say free or gluten-free, you know, or you could pretty well bet that that product contains those things and therefore could in fact be a causative factor to your gastrointestinal issues, including celiac disease. So now Dr. Jensen is going to try and wrap up our program talking about enzyme deficiencies. Dr. Jensen.
Thank you, Dr. Lala. Well, part of this thing when I was talking about that, we putting a lot of different secretions into the proximal part of the small intestine come from the pancreas, and so we have so we're looking at pancreatic enzymes, and in this case, pancreatic enzyme deficiency. And that pancreatic secretions of insulin and enzymes affects celiac disease to a great deal. Insulin affects our blood glucose regulation, and then the pancreas helps us in our digestion of fats, proteins, and sugars, such as in pancreatic lipase that digests the fats, helps break them apart, cut them, shall we say, so that the long chains become shorter chains and then much shorter. Pancreatic protease breaks down proteins into their constituent amino acids so that they become building blocks that the body can just take in the building blocks and build what it needs. And then we have pancreatic amylase, which amylase comes from, or should I say, breaks down starches and sugars. And so that's very important as we start to see that it's important that we have complex carbohydrates, which are long-chain carbohydrates. It breaks them down into simple sugars and allows for that absorption at that point. But it's not as fast as the simple sugars just being dumped in, which the insulin has works with a great deal. Pancreatic secretions are about 1.5 quarts of secretions average daily from the pancreatic into the small intestine. That's a lot of enzymes for that to push forth. And then we have, to function correctly, the alkalinity has to be changed. If it was acid, the secretions are destroyed, creating dysbiosis, which is a disrelationship of good bacteria to bad bacteria within the body. Or not just bad bacteria, but we're also looking at protozoa, yeast, and fungi, those kinds of things that are in the body that can be deleterious, such as candidiasis or yeast infections can be part of that. So something else to consider, the uses of pancreatic enzymes help with digestive dysbiosis. So if you're taking these as a supplement, they can also help with pancreatic insufficiency. They can help with such diagnoses as cystic fibrosis, not the actual diagnosis itself, but the disease itself. It can help with a great deal. Food allergies. It can help with digestion of some of those things that you're sensitive to, help break them down more, and also help to not create more food allergies, as well as help us with, keep us from autoimmune disorders, which can be created from all that inflammation that's throughout the body. So dysbiosis of the GI microflora, this is where we're looking at a disrelationship of the microflora within the gastrointestinal tract. And this is where it upsets the GI tract pH. Usually it's caused by misuse of antibiotics. And the normal microflora are destroyed, rendering mucosal lining to irritation and increased permeability, as we talked earlier in the show, allowing foreign chemicals to enter the bloodstream. So Dr. Lala.
So we've been talking about protein, gluten proteins. What are they? What are gluten proteins? All foods contain antigens, which, if identified by the body as foreign, will cause an immune or an antibody reactions. Grains, including wheat, rye, barley, are more common sources of gluten proteins. Now, celiac disease is also genetically related. So genetic weakness or inability to properly digest glutens causes inflammation of the intestinal mucosa of the small intestine, and an antigen-antibody reaction occurs there, predisposing the person to symptoms that we call villus, this little villi of atrophy. They shrink. It's just not, though, avoiding glutens. In addition to avoiding glutens, hypersensitivity Most celiac patients also have other undiagnosed food sensitivities and biochemical imbalances. Certainly the treatment would be to first diagnose not only do you have that, but any other food allergens through food allergy testing. Avoid the glutens, be bioidentification. 10% of people suffering with celiac disease have an atypical forms of the disease, therefore do not present gastrointestinal symptoms. Some other probable autoimmune disorders are SLE or systemic lupus erythematosus, Hashimoto's thyroiditis, Goodpasture syndrome, Graves' disease, it's another thyroid problem, myasthenia gravis, and thrombocytic purpura. Now, some probable autoimmune disorders include, as Dr. Jensen mentioned here earlier, rheumatoid arthritis, scleroderma, poliomyelitis, and pernicious anemia. There also include idiopathic Addison's disease, not Addison, Addison's disease, infertility, diabetes, asthma, and cystic fibrosis. Some other probable autoimmune-related diseases include chronic hepatitis, primary biliary sclerosis, other endocrine gland failures, vitiglio, vasculitis, and post-myocardial infarctions. Now, what is the importance here? The importance is of diagnosing the IgA, and IgG testing. So IgG is for fixed food sensitivities. That means as soon as I eat that, or relatively quick after eating, I'm going to have a reaction. But the other test that is often not performed is the IgG4 cyclic. It checks for ones that can occur a little bit later on. And then there is also what they call the anti-TTG, meaning tissue transglutamase, and that's an enzyme. So it's important that these tests be performed and that you get to a nutritionally oriented physician, such as a chiropractor, who is science-based nutrition. I'm not talking about people who are practicing voodoo nutrition and unscientific things, but that they're doing accepted scientific tests, such as those IgG tests, such as organic acid tests, and a chem screen. Those are very, very important. And as Dr. Jensen was going to say, the National Institute of Health recommends testing of all individuals with symptoms as well as relatives of celiac disease patients, including type 1 diabetes, Down syndrome, Turner syndrome, Williams syndrome, selective IgA deficiency, and autoimmune disorders. That's the National Health Institute, and I want to tell you, it's not being done. It's not being done. You cannot believe the number of people that we see that have not been properly diagnosed. Let us also remember that Jesus, he's not a religious Jesus, he's just Jesus. He can be in any denomination or non-denomination, but he is the great physician. And if we turn to him and seek his intervention in our life, knock on his door until we find either supernatural healing or we find somebody who really knows what they're doing. There are a lot of licensed chiropractors and other health practitioners who have licenses, but they're not doing their jobs. If you work inside of the health industry, you would see that. And so it is imperative that if you want to find out what's wrong with you, that you get to somebody who's going to truly look at you from a Mayo Clinic perspective, as Mayo Clinic does in a medical perspective. I couldn't see us. We're going to YouTube. No, that's
that's